All right, we are preparing the live stream,
Okay.
and we are so excited to have you all here with us this evening. Welcome to tonight's town hall. During the presentation, if you have any questions you would like to ask the panelists or Carla, please feel free to chat them either in the Q&A section or in the chat. Then at the Q&A session, we will unmute you and you can ask your question live. So putting them in there will let us know that you have questions so we can get prepared for that section. Again, thank you so much for joining us this evening. It's my pleasure to introduce you to Carla Bailey-Smith, candidate for District 88 State Representative. Carla?
Thank you. So I decided to call my series of town halls Why Vote? Because voting directly impacts policy decisions and what services we have in our towns and our counties. I am proud to be endorsed by Planned Parenthood Illinois Action, and I am committed to ensuring a woman's right to consent over her own body. McLean and Tazewell counties and the surrounding areas are overwhelmingly represented by Republican men. All of them voted no on HB 40 and on bills regarding access to birth control and on comprehensive sex education. Women of Central Illinois deserve an ally in Springfield, and the key to reducing the need for abortions is better access to comprehensive sex education and birth control. Our first panelist is Brigid Leahy, who is the Senior Director of Public Policy and Treasurer of the Planned Parenthood Illinois Action PAC. Thank you for joining us, Brigid.
Thank you for having me.
I am so sorry, we're not sure what happened with Brigid's video. She is designated a panelist. She joined as a panelist and her video should be working and it's not, and I really apologize for that. We'll try and figure out what happened and rectify that in the future. So, Brigid, my first question is, as this pandemic began to shut down normal life in the USA, we have seen other states try to use this time to roll back access to abortion services. Should we be concerned in Illinois that lawmakers will try to undo the protections that we currently have?
So here in Illinois, we are really lucky, and I really shouldn't say lucky because lucky doesn't play into it. It really is because people voted. That we have a General Assembly and a governor and a Attorney General here in Illinois that support reproductive rights, that support your and my and everyone who has tuned in tonight, all of our rights to make decisions about our personal health care, these private decisions that we make with our medical providers. And so therefore, unlike some other states, like you may have heard of, Texas is one of them that has been going back and forth in court, saying that during a stay-at-home order, when they have been restricting things like telling hospitals you can only do you can't do any elective procedures, you can only do emergency procedures, etc. We in Illinois do not have that restriction that has targeted abortion. We disagree at Planned Parenthood with what some of the politicians in other states have been saying about their orders, because abortion is not just a procedure that somebody up one day decides, I feel like I'm going to have an abortion. In fact, abortion, like many other aspects of reproductive health care, is time sensitive, and that delaying it can increase risk to patients and it can cause harm to patients. So therefore, in Illinois, providers are still providing abortion care, and we do not expect any restrictions by our state elected officials on that.
Well, that's a relief. So tell us now about the decision by Planned Parenthood of Illinois to only have 6 locations open during the pandemic. Are the clinics that remain open able to handle the number of patients needing care?
So, Carla, thank you so much for asking about this, because I know that it is really tough for everyone who have had to stay at home. It's great to be on here and be able to connect with people and let them know what we are providing. I, like so many others, have been staying home for a month, and I myself had to put off a routine visit with my family practice physician because it's not necessary at this time to put people at risk by having them come in to healthcare providers when certain types of care can be delayed. So when there were a lot of things that went into our decision, and first and foremost was our commitment to continue to provide essential reproductive and sexual health services during this unprecedented time. We did have to make adjustments, just like a lot of places of business, a lot of healthcare providers, because of the COVID-19 pandemic. And there were a number of factors that went into our decision to consolidate into 6 mission sites, which are located in Peoria, Springfield, Aurora, Flossmoor, and Chicago. Because of the stay-at-home order, we are trying to limit services to what is essential for patients and to avoid delaying anything that would increase risk or cause harm to a patient. So right now we are offering a full range of reproductive and sexual health care, including abortion, at the 6 sites that I mentioned. In order to get care that you need, you should call Planned Parenthood of Illinois at 1-877-200 PPIL. That's 877-200 PPIL. Or go to PPIL's website. Planned Parenthood of Illinois' website is ppil.org. Planned Parenthood of Illinois is doing a lot of things to ensure that patients can still get the care they need in a safe environment, and that is why PPIL has made online video, online services, telehealth. You can make an appointment online. All these things are available for patients. And in fact, Planned Parenthood nationally rolled out telehealth during the pandemic to make sure that everywhere across the country has access to telehealth services through Planned Parenthood, because there were some places that weren't routinely doing telehealth. So it's now available for Planned Parenthood across the country. And so, for example, for services like the birth control pill, the patch, the ring, or getting treatment for a urinary tract infection, which is quite common, you can actually use an app, Planned Parenthood Direct. You can go in the App Store, search Planned Parenthood Direct, or go online to plannedparenthooddirect.org, get the app, and you can go online and consult with a practitioner and get birth control pills sent to you in the mail. We also have a lot of other options to us as patients, and they include, having an appointment where you are talking directly via Skype or something like that with with a practitioner who's in the health center. And for a lot of patients' concerns, they can be handled over the phone. So, and then of course, for any patient that needs to come in for care in person, Planned Parenthood of Illinois has taken certain measures to make sure that everyone is as safe as possible. So every patient is pre-screened for signs and symptoms of COVID-19. So are all the staff every day before they walk in the door. The health center staff are wearing masks, and all patients are given masks to wear. In addition, all of the staff in the health center have increased cleaning and sanitizing procedures to make sure that all the CDC recommendations are being followed.
That's such a relief to hear. I know that a friend of mine has some health concerns and was a little afraid to make an appointment and go in to be seen for some healthcare issues, and I'm really glad to hear that. So can
I
new
apologize.
that
I have a dog.
yep.
This is
Hi,
life
Brigid's the dog.
working from home.
Yep. So can new patients or just returning patients use the new app?
Actually, new patients and existing patients both can use telehealth, can use the Planned Parenthood Direct app. All of that is available. New patient intake can be done through the telehealth. And so again, the website is ppil.org.
Okay.
And the phone number to call is 877-200-PPIL.
Great. So a big concern about people being stuck at home together for long periods of time is sexual violence and unwanted pregnancies during this time of quarantine. If someone has had unprotected sex and does not want it to result in a pregnancy, what should they do? And if someone has experienced sexual assault or rape, who should they call?
Okay, that's a really, really important thing to raise in this time. First of all, I remember when the stay-at-home orders were first issued, there were, I think, some cheeky articles about, oh, we're going to have all these COVID babies in 9 months, kind of after you have a blizzard or a blackout. And I will say, I am a blizzard of 1967 baby. However, the difference with this is that this has been a long-term stay at home, and we are all recognizing that there is a lot of tension when you are confined with people that you may not have the best relationship with. Also, there's a lot of tension if people have been laid off and are facing economic challenges about how they're going to pay for dinner, how they're going to pay the rent. And those are the times when violence, domestic violence, sexual violence can really be heightened, and the risk for them can be heightened. So it's very important that anyone who has been sexually assaulted gets the care that they need. I encourage anyone who has experienced sexual assault to contact the National Sexual Assault Hotline. That is 1-800-656-HOPE, HOPE. The hotline can link you to your local rape crisis center for counseling and services, because obviously there's the healthcare aspect of it, and then there's the emotional support, the legal support, etc., that you may need. So that's 1-800-656-HOPE. Also, Planned Parenthood of Illinois provides things like emergency contraception, which prevents pregnancy after unprotected sex. And that can be done over the phone and through telehealth, where the prescription can be sent to a pharmacy. This is really important that emergency contraception is accessed as soon as possible. It is more effective the sooner that you take it. And so we recommend contacting us as soon as possible about emergency contraception. And if a patient can get to the health center, emergency contraception is available in a walk-in pickup basis. From what I have over the years working with our partners in the sexual assault services community, I've known that pregnancy is the first concern of a survivor of sexual assault. Another very immediate concern is being exposed to a sexually transmitted infection or HIV. And again, Planned Parenthood of Illinois can screen for those. And provide medication to treat sexually transmitted infections. So in addition to those healthcare services, Planned Parenthood of Illinois has on staff licensed clinical social workers who are available over the phone for direct counseling and help with navigating referrals, connecting to services, and things like that. So again, calling Planned Parenthood of Illinois at 877-200-PPIL, or going to PPIL's website, ppil.org, can connect you to getting in for services should you need emergency contraception or testing and treatment for a sexually transmitted infection. The other thing that we're very concerned about is domestic violence. Mm-hmm. Sexual violence can be part of domestic violence, but the domestic violence groups are very concerned about people being isolated in their homes with abuse and with the added stresses that come with the stay-at-home order. And so I'm very glad that legislators, the governor, these organizations have been trying to promote the domestic violence hotline. The Illinois Domestic Violence Hotline is 877-863-6338. That hotline can connect you to services if you are experiencing violence in your home. The domestic violence groups also recognize that sometimes it may not be safe to make a phone call, and therefore they have a chat option so that you can do this in quiet and reach out in quiet and in safety through your phone and or on your laptop. And that website to connect to the chat is thehotline.org. So THEHOTLINE.org. And you can chat silently so that the person in the home that is the abuser doesn't necessarily know that you have reached out and made contact. So again, the domestic violence hotline, 877-863-6338. Or the website is the hotline. And then for the National Sexual Assault Hotline, that is 800-656-HOPE, HOPE. And again, all of these numbers, including Planned Parenthood's number, they're all toll free.
That's wonderful. And I'm so glad to hear about the website, thehotline.org, because if somebody's experiencing domestic violence and they can't make that phone call and risk being heard, it'll just look like they're texting and doing normal stuff on their phones. So that's really helpful. Another question I had was about people who are receiving gender-affirming hormone therapy. Are they still able to get the services they need during this time? And I was also wondering about the labs, because any kind of hormone therapy that you're having, you have to have regular blood work. So I was wondering if you have to do all the labs at Planned Parenthood, or during this emergency, can people get blood work done maybe somewhere closer to where they live and then have the information sent over to Planned Parenthood?
Really good question, and I'm glad you brought up this service because a lot of people may not be aware that Planned Parenthood of Illinois provides gender-affirming hormone therapy to the community, as well as a number of other services for the LGBTQ community. I think it's really important to know that anyone who comes to Planned Parenthood is welcome. We want to be there for patients no matter what they look like, who they love, whether or not they have insurance, whether or not they're on Medicaid, can afford to pay, whatever it is, you are welcome at Planned Parenthood, and you will be treated with dignity and respect, and your decisions will definitely be supported. And one of the things was that a few years ago, as part of our commitment to make sure that we were serving people where they were, was recognizing that we had patients who were coming to us who were then also having to drive 200 miles or more to access gender-affirming hormone therapy. And therefore, I'm very proud of our leadership to make the decision that we needed to add this service along with, we also provide PrEP, which is pre-exposure
Oh, sure.
prophylaxis to prevent HIV. I think that some of our locations in Central Illinois are the only place that you can get PrEP. So it's really important that we are constantly looking at the services that we provide and making sure that we are trying to incorporate as much as possible to provide excellent care to our patients. So with gender-affirming hormone therapy, anyone can get started. If you're a new patient, you can contact Planned Parenthood of Illinois and get started over telehealth. So there's no reason to think that you have to wait. I know today the governor announced that the stay-at-home order is going to be extended another month. If you've had a plan that you want to start talking to somebody about this and finding out what is entailed in it, you don't have to wait until the end of May. You can contact Planned Parenthood of Illinois and have a telehealth appointment to get that started. For existing patients, they can continue all of their care over telehealth or over the phone. All of our health centers that are open can do blood work, but it is important to know that especially since we don't have every health center open right now, that we have agreements with local LabCorp facilities that do a lot of our lab work, and we can make arrangements to have blood work done closer to where the patient is. So if it's more convenient for the patient, that can be worked out. And again, that would be done through calling 877-200-PPIL or going to the website ppil.org.
Oh, I'm really glad to hear that. So my last question about access to healthcare during this time of COVID-19 is people who live far away from what is now their nearest clinic, because you only have 6 open, what if they rely on public transportation? Does Planned Parenthood have anything in place to help those people out?
That is really an excellent question, and I think that's very thoughtful for you to recognize that the impact of stay at home and shutting down services in various communities across our state and our country affect us all differently depending on where we are and what we have. So if you do not have a car and cannot drive from another town to get to Peoria or Springfield, then you do need help with that. Thankfully, I am really happy to say that Planned Parenthood of Illinois had already a contract agreement with a rideshare company prior to this happening.
Oh,
and
okay.
Yes, Planned Parenthood of Illinois had been doing this for a while, recognizing that in some areas, public transportation is not readily available. It may be very available to the health centers that are in the Chicagoland area that have buses and the L and all kinds of options, but particularly in Central Illinois or in some of the suburban areas, you can really be stranded if you don't have access to a car. So again, contact Planned Parenthood of Illinois at that 800 that number 877-200-PPIL, or and they can help arrange to get transportation so that patients can get where they need, because we want to make sure that everybody gets the care they need.
Right. Oh.
The one thing I will say is that for rides, and this is not our restriction, this is a requirement of the rideshare company, is that people under 18 cannot ride by themselves.
Right.
And so there needs to be an adult with them. But otherwise, yes, transportation is available.
Okay, well, I am so glad to hear that. We also have Jackie Gunderson with us tonight. Each time I do a town hall, I'm going to be inviting other people who are also currently running for office. Jackie is running for County Board District 9, which is in my state legislative district and covers a most unusual shape of the south side of Bloomington. Jackie, please tell us a little bit about what decisions the county board makes that impact healthcare in McLean County.
All right, thank you for having me here today, Carla. I'm so glad I got to hear a little bit of what Brigid had to share. And Brigid, thank you for sharing all of that important information. I'm a huge Planned Parenthood fan and supporter, and I'm so thankful that you are able to share all of these ways that people can still access such important healthcare, especially during this unprecedented time. So thank you so much for not only sharing that with us, but for Planned Parenthood's commitment to continuing that. So as Carla mentioned, I am currently running for McLean County Board, and so I'm going to share some insight into my understanding of the types of decisions that the county board makes, especially the ones that would impact healthcare in McLean County. But just to be clear, this is my first time running, so I do not yet have firsthand experience with the inner workings of county government, although I am working to learn as much as I can. I want to start by commenting on and commending the McLean County Health Department for their continuous and consistent response to the rapidly evolving COVID-19 crisis. The information that they have been sharing through their social media and their website is clear, and it's easy to understand, and most importantly, it's backed by science. Following the CDC and the Illinois Department of Public Health guidelines. I know for me personally, if I want to listen to someone, I'm going to try to listen to somebody who is following science. So that is really important to me, that the local health department has been very clear about that is their path. And early on, they shared something that was just incredibly impactful to me. It was a post on their social media, and it was encouraging people to carefully consider the language that they use to describe this disease. And it was ensuring that the language that we use doesn't dehumanize those who have the disease or create unnecessary fear. So I'm someone who believes that the words that we use really do matter. So I really appreciated their willingness to help folks avoid promoting stigma and misinformation and fear during a time that's already difficult for so many people. So if you haven't seen it, go out and look at that and share it. It's important. And I think it says right on the top, the words we use matter. And then back to the county board. If you are someone who is not familiar how the county board works, which by the way is completely understandable, the website is not very user-friendly. They have only recently moved the meetings to not only a more accessible time of day, which is Tuesday evening instead of Tuesday mid-morning, but they've also moved to an online streaming platform for easier access thanks to the COVID-19 crisis. So it is not easy to know that much about our county government just through the platforms that we have available to us. So I'm going to give you just a quick County Government 101 lesson. So I'm going to breeze right through this. If you have questions, jot them down and we'll talk about them afterwards, okay? So our county operates under a county board, which is a form of government that is mandated by the state of Illinois, in addition to 8 independently elected county officials. So the county board is comprised of 20 members, 2 representatives from each of the 10 districts who serve 4 terms. So like Carla said, I'm running for a very long and skinny district that runs from the west end of Bloomington on the southern band of Bloomington all the way across Bloomington to the far east side of southern Bloomington. It's very long and skinny and snaky. So there are 10 districts. There are 2 representatives from each of those districts. The board is both a legislative policymaker and the supervisor of county administration. So the county administrator is a hired position, and she is the chief administrative officer and prepares and recommends the annual budget, implements policies and procedures, and manages daily operations as well as overseeing the appointed department directors. The 8 independently elected county officials are the auditor, the clerk of the circuit court, the coroner, the county clerk or recorder, the sheriff, the state's attorney, the regional superintendent of education, and the treasurer. These elected officials also serve 4-year terms. The county provides a full range of services, which includes administration of justice and public safety, including the operation of a 225-bed adult detention facility and a 26-bed juvenile detention facility, construction and maintenance of 368 miles of county roads and 87 bridges, administration of public health services and programs, operation of a 150-bed nursing home, operation of the 2,200-acre recreation area known as Kamlara Park, and collection of taxes for over 200 taxing districts, administration of elections, and general administrative services. All right, so I can't see your faces, but if you can use the function to say who learned something new here. Did anybody learn anything new? Okay, Carla did. Feel free to chime in. And all of that is knowledge that I have only recently gained. So don't feel bad if that was new information to you. And like I said, the website's not super easy to access that. You kind of have to dig around to find that information. So totally understandable if that was new information to you. So that was your Government 101. All right. Let's see. So as I mentioned, the county board is a legislative policy-making body as well as the supervisor of all county administration. So each of the departments listed above that I just listed out report back to the 10 smaller committees within the county board. This is the part where I finally get around to what Carla asked me, which was how does the McLean County Board impact healthcare here in our county? And it's primarily through our health committee and their oversight of the health department. The health department is operated by employees that then report back to the county board through the health committee, and especially on their financial needs. So they are decision makers within their department, but they have to report back on their financial needs and their financial statements. The department serves the largest geographic county in Illinois, which is also something I just recently learned. McLean County is the biggest geographical county in our state. And it serves over 165,000 residents. Many of the residents may never walk through the doors of the health department, but I promise that they will benefit in some way from the various programs and services that are offered through the McLean County Health Department. For example, there is a personal health and communicable disease clinic at McLean County Health Department that offers screening, testing, treatment, and prevention services for sexually transmitted infections, or STIs, along with HIV and AIDS counseling and testing. And then another group I wanted to highlight that operates under the county government that has been gaining considerable momentum in our recent years is the Behavioral Health Coordinating Council. And they spend a lot of time and resources looking at the important issue of mental health in our community. That is actually one of the main reasons why I put my name on this ballot, is I believe in the access to mental health resources, and that we use our resources to make sure we connect with the most vulnerable citizens in our county. And so that coordinating council was 2 different groups that were combined, and they've done a lot of work in the last couple of years to move the arrow towards better mental health in our community. So that's a really long, drawn out answer to your question, but the board itself does not make any decisions that affect our day-to-day health or the access to health, but they oversee the departments and the committees that do.
Right. Wow, that is definitely a lot to take in, but thank you for that, because it's one of my #1 missions in running for this office is to really bring forward why it's so important to vote down ballot, what all of our local elected officials are doing that affect it. You know, it does affect the quality of the services that exist here in McLean County. you know, and it, I mean, we wouldn't have a behavioral health coordinating council if it were not for the implementation of that by the county board. So you need to pay attention to who's running for county board. And you know what? Occasionally, I would recommend you tune in to a county board meeting. And it's so much easier now that they're online and you can see everybody's faces because they know how to do they've got their technology figured out. And you can see what they're talking about and listen to the decisions that they're making for the services in our county.
Their committee meetings are also now broadcast as well. So that information is on the website. You can click on each of the committees and you can see their meetings, the times, and when you can view them through the digital format as well.
So Jackie, if you are elected, is there a committee that you hope to be appointed to? And I would like to point out that the committee appointments they're made by the chair, aren't they? You don't really have a say in what your committee appointment is. Is that correct?
That is correct. Everybody serves on more than one committee, usually two, but there are some that I think serve on more than two. And you are correct. The chair is the one who determines that. So right now, the chair is someone who's been there for a long time and has always put people where he believes that they fit best without ever asking them what experiences they bring to the table. So I bring a little bit of a diverse background. I have a little bit longer back of healthcare experience. I also have considerable amount of community engagement with people with mental health conditions and mental health access issues. And so mental health is really important to me, and I'd love to be involved with the health committee. But I also worked in agriculture for a long time, and I, the last 9 years, I worked in an agricultural facility. And so those 368 miles of county roads, I am very familiar with. And I also work for Illinois State University in a very technical role where I am over the purchasing and procurement of all construction and building facility purchases. So I would have a insight on how the money is spent and how we procure things in the county. So I could really see myself fitting in a few of these, unless there is a flip in the majority of our current county board. I will not have much of a say depending on who the chair is. But if there is a flip, then the chair will be potentially different, and then that could be a different story. So it matters that people go out and vote.
Yes, it does. Okay, were there any questions for Jackie? I'm just going to quickly check Facebook. No, there's no comments there. Kelsey, are there any questions on the?
There were not any questions
in the Zoom chat. Okay,
but you did get a couple of hands when you asked who here learned something. So I wanted to make sure you did, in fact, see that, Jackie. Your County Board 101 was well received. So thank you.
Right. Yeah.
I'm glad to hear that.
Okay, so I want to just hone in one more time on the importance of voting, and just remind everybody that we've witnessed other states enacting some really draconian rules that have, in the past number of years, that have closed many and sometimes all Planned Parenthood clinics, which we have heard provides so many important services, and not just to women, but to people of all sexual identities, and a very, very wide variety of health services that they offer. And if we want to have a county with good services, infrastructure, and oversight, then we need to pay attention to who is on our county board, and we need to pay attention to who is representing us in Springfield. And I hope that by showing you a little more of who I am and the things that I care about, that I will earn your vote in November. And is Brigid still with us? Are you still here, Brigid?
I am. I'm here.
So I wanted to ask you, I know the legislature is kind of, I mean, they're not meeting, and they should be, but were there any legislative actions planned that Planned Parenthood of Illinois was trying to work on for this legislative session?
That's a great question, and I'm glad you brought it up, because it points out how important it is to elect people who can support access to health care and make sure that we have the information that we need to be safe and healthy. So there were a number of things that were in the works in the General Assembly before the COVID-19 pandemic hit, and most of them will be sidelined, unfortunately, because of an abbreviated session. The legislature really is focusing on the top issues, which are making sure that the state budget is passed. There's a constitutional deadline to pass the FY21 budget by May 31st. And they're also considering what emergency measures they may need to pass that are must-dos in order to assist with the COVID-19 response, and also with the economic issues that people are facing. So a lot of the things that were going on in the session are going to be delayed. One of the things that still continues is funding for healthcare services, and in particular for sexual and reproductive healthcare services, which is typically called family planning. Nationwide, the Trump-Pence administration has repeatedly attacked access to healthcare, including access to reproductive healthcare. One thing that they were successful in doing was imposing a gag rule on the nation's family planning program, the Title X program. This program has been around for over 40 years. Planned Parenthood affiliates across the country have participated in it during that time. It is instrumental in allowing access for millions of people across the country to basic health care. It is your annual exam with your pap test and your breast exam. It's birth control. It's testing and treatment for sexually transmitted infections. It's all those basic family planning services. And it is important for people who are lower income and are uninsured. It is the only program out there like this in the country. And what the Trump-Pence administration did was impose a gag rule that limits what providers in the Title X program can talk about when it comes to abortion. And it also restricts the ability to refer for abortion services. I'll be clear, the Title X family planning program has never paid for abortions. It is not part of the program. Not one dime of Title X money goes for abortions. But the Trump-Pence administration was using this health program as a tool in its political game around abortion politics. And what happened was a lot of people are at risk of losing care. As a result of the gag rule in Illinois, Planned Parenthood of Illinois, as well as the state of Illinois, which gets Title X funding for a grant through the Department of Public Health, we were forced out of the program because it is just not medically ethical to deny patients medically relevant information. You can't, it's not appropriate, and medical professionals just would not say, oh, well, sorry, you're this kind of patient. We're not going to tell you about what you may need or give you the information if you ask about it. So we were forced out of the program. This affects dozens of providers across the state, including Planned Parenthood of Illinois, but a lot of local health departments, some hospitals, community clinics. And so what we were working on was getting funding to make sure that those services could continue in the next fiscal year. Planned Parenthood set aside some emergency money that we got because of some generous donors. So we've been continuing to see patients who are eligible for this program. Governor Pritzker committed to finding money in the state budget for those who were funded through the Department of Public Health. So we were able to carry on for several months. But in the FY21 budget, we were hoping to get funding put in there to make sure that people can continue to get care. We're still working on that. I've got to be honest, I don't know what's going to happen with the state budget. The state is facing severe, issues because of, obviously, a lot of people aren't getting income. People are not shopping. They're not paying sales tax. We're going to see a real downturn in revenue for the state of Illinois. And I don't envy the legislators who are having these decisions. So our message really is to legislators to please try as much as possible to protect the safety net in Illinois and to make sure that those who are most vulnerable during COVID-19 and during the economic fallout from COVID-19, that they will continue to have access to health care. So we're still working on that. A couple other issues that we're probably going to table until the fall or maybe even until the next session in January. Our sex ed legislation. We have a bill called the Responsible Education for Adolescent and Children's Health Act. This is a great step forward if we could get this passed. Many people may not realize it, but in Illinois, schools are not required to teach sex education. They can teach it if they want to, but if they don't want to, they don't have to. And a lot of young people are not getting the information they need when it comes to staying safe and healthy. Another thing that we're working on is issues around maternal health disparities. Maternal health is an important issue for a developed country like the United States. Our maternal health outcomes are not that great. And when you look at certain areas in the country and in Illinois, women of color are at much, much higher risk of complications and poor outcomes and even death. And their rates, depending on where they live and their circumstances, can be like a developing country, not like what we would consider would be the expectation for maternal health in the United States of America. So we've been working with legislators for a couple of years to do a number of things to make sure that coverage in health insurance is better, coverage in Medicaid is better, that we are making sure that we have coverage so that postpartum people can get treatment for postpartum depression. We know that a lot of complications occur after someone would lose, like last year, previously, 60 days postpartum, you'd lose your Medicaid coverage if pregnancy was one of the reasons you qualified for Medicaid. Well, some of the complications can actually, on average, it's around day 66 that a person might need extra intervention around postpartum care. So we want to do that. We're working with a group of doulas in Chicago. I don't know if everybody on here is familiar with what doulas do. They are supporters for somebody who is pregnant and throughout the delivery and the postpartum period. They're not a medical professional. They are there. They know the process of birth. A lot of them are trained in things like coaching for breastfeeding. They are there really as a support system to coach and help someone during labor and delivery. And we have seen study after study that doulas do improve outcomes and improve the health of the pregnant person and the baby. And so we would love to get doulas covered in Medicaid. And we've been working with a group of doulas that serve Black women in Chicago. And so we've been doing a lot of different interesting things, and I'm looking forward to continuing that once we get through the crisis that we're in right now. We will go back and be focusing on these things, because the work is never done. It is never done, and we need to make sure that we elect people who understand the importance of these issues. Mm-hmm. And we need to make sure that we're encouraging people to register to vote, to go and vote. And I would love it if everyone who's participating in this tonight would pledge that when they vote, they bring 3 other people with them, or if you plan to vote, by absentee or vote by mail and request a ballot, which many people may be doing considering what we're going through right now, encourage your family and friends to do the same thing, and say, hey, let's all promise together to fill out our ballots and mail them in at the same time, because the more people who vote, the better we will all be.
That's right. Oh, you said it perfectly, Brigid. Thank you so much. Thank you for participating. I apologize again about the video. I will learn. I will do better. I was fascinated to hear about the legislation that Planned Parenthood is working on to increase the health, postpartum health of mothers, the outcomes. It's just it's unbelievable in a way that a country that has the resources that we have, that we're still losing mothers in childbirth or soon after childbirth, so I hope that I will be in the legislature and I can help you push that forward. That would be a really exciting thing for me to help with, as well as the comprehensive sex education, because of course we want to prevent the need for abortions, and we want people to have healthy sex lives, and we want people to avoid unnecessary sexually transmitted infections.
Carla, I would love to have you there. That is a big focus of the REACH Act, the Responsible Education for Adolescent and Children's Health Act, is a big focus on healthy relationships, and of course things like pregnancy prevention, but also making sure that young people understand about consent, that we reduce the risk of violence, that we make sure that relationships are healthy and fulfilling, and unfortunately, your opponent does not have a great record on these issues. The last time we dealt with sex ed, which was a bill basically to make sure that sex education, if schools were teaching it, was medically accurate and age appropriate, he did not support that, which I don't think that's a big ask to say sex ed should be medically accurate and age appropriate. So we would love to see change in the General Assembly, and I look forward to working with you in the future.
Thank you very much. And before we sign off, does anybody have any questions? Jackie's still here. Brigid, any questions for me? I'll quickly check the Facebook feed and see. No, I don't see any comments there.
So no questions right now, but just a quick reminder, you can follow everything that is happening with Carla's campaign by following her. Her handle is Carla, the number 4 IL88 on most major social networks. So please feel free to reach out there and check in at the next town hall as well. So still no questions. But thank you so much, everyone, for your time this evening, for sure.
Yes, and before we end it, I'll give a plug for next week. The plan next week is I will have all 3 Democratic candidates that are running in Tazewell County, because my legislative district covers most, but not all, of Tazewell County. Not most, a big area of Tazewell County. So we'll have all 3 of the county board members, and the idea is to talk about health. We're trying to find the right people who have permission to talk about healthcare in Tazewell County. It's a little tricky because I am a candidate, and unfortunately, someone who's actively working in a healthcare situation, often they are not allowed to come on and talk about the healthcare that they're providing because I am a candidate and we'll have candidates on. So, but we will talk with Tazewell County Board candidates next week. So look for that. And thank you, everyone, and good night and be well.